Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Posterior Cervical Fusion. Introduction. Neck and arm pain caused by unstable vertebrae in the neck are common conditions that limit your ability to move, walk, and work. Unstable vertebrae in the neck can result in an unstable spine where one vertebra slips over another. This condition can be very painful. Doctors may recommend surgery to fuse and stabilize the neck for people suffering from an unstable spine. If your doctor recommends surgical treatment for your condition, the decision whether or not to have surgery is also yours. This patient education module will help you understand the benefits and risks of this surgery. Anatomy. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is formed of solid vertebrae. The vertebrae are separated by softer discs. Symptoms and their causes. A vertebra that slips out of place over another vertebra may press on the spinal cord or nerves. This causes pain, weakness, and numbness in the neck, arms, and legs. The pressure can be from the overgrowth of the joints that help hold the vertebrae together. These bony overgrowths can cause compression of the nerves. The pressure can also come from the ligaments that help maintain the spine together. When these increase in size to help prevent the instability, the excessive growth can cause compression of the nerves. The pressure could also come from a disc herniation. The most common cause of this condition is a cervical fracture. A fracture or crack in a vertebra may cause it to lose its position. Very rarely, spinal defects from birth can cause vertebrae to slip. The aging of the spine may lead to an unstable condition. Tumors in or near the spine can also result in slippage of the vertebrae. Previous neck surgery could also make the spine vulnerable to instability. Injuries such as a car accident may damage the vertebrae in the neck and make them unstable.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. The pain from this condition is usually worse when moving the neck from side to side or up and down. Resting may help to reduce the pain. Use of a cervical collar may help with the symptoms. Physical therapy may also relieve the symptoms. Mild traction could also be used. Medications can be helpful in decreasing the swelling and inflammation. If the pain is still bad enough to interfere with your lifestyle after trying exercise and medication, your doctor may recommend surgery. In case of injuries such as a car accident, an operation may be necessary to prevent further damage to the spine and spinal cord. Surgical treatment. The operation is done under general anesthesia. The spine is approached from the back. There are three major objectives for this surgery. The first one is to remove the bone and ligaments causing pressure on the nerves. The second objective is to stabilize the spine by fusing the vertebrae so they no longer slip with movement. A piece of bone is usually used to fuse the vertebrae. Lastly, the operation aims at restoring the normal shape of the spine as much as possible. This is done through implantable devices that hold the fusion together. The bone that is used in surgery can come from different sources. Some of it could come from the bone that was removed to take the pressure off the nerves. It could also be taken from the hip or ribs during the surgery. Alternatively, a piece of banked bone is taken from cadavers. It is tested for known diseases prior to placing it in your neck. In some cases, high-grade medical quality plastic is used to strengthen the fusion. Your doctor will discuss with you the recommended source of the fusion bone or material. Biogenetically engineered materials are now available to promote the growth of your own bone. Some of these materials include BMP, or bone morphogenic protein. These are placed where traditional bone used to be placed. To hold the fused vertebrae together and help restore the shape of the spine, a variety of medical devices may be used. Steel rods are one option. Notched plates can also be used to hold the fused vertebrae together. Screws are another option for holding the fused vertebrae together. Metal devices are needed to hold the vertebrae together while the fusion takes place. This takes about 3 months. Some recent devices, specifically some screws, may not yet be FDA approved except as experimental devices. However, these devices are recommended by most spine specialists to help create a solid fusion. After the placement of the devices, the surgeon may put more bone on either side of the device to further strengthen the fusion. Your doctor will discuss with you the recommended devices. At the end of the surgery, the skin is closed. You will possibly be required to wear some kind of neck collar for a few weeks after the operation to immobilize the neck. Your doctor will tell you how long you are likely to stay in the hospital after the surgery. This depends on several factors, such as your age and medical condition. Depending on how well you do, you may go home within 2 to 3 days. Risks and complications. This operation is very safe. There are, however, several possible risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you're allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. They might occur from the spinal surgery or from the operation to remove a piece of bone from the hip or ribs if it is performed. These risks include infection deep in the disc space or at the skin level, bleeding, a skin scar that may be painful or ugly. The hip incision where the bone is taken from tends to hurt a lot after the surgery. This rarely lasts for a long time, but it is sometimes more painful than the spine incision. There is a very slight risk of bowel injury or hernia. When the bone is taken from the ribs, there is a small risk of lung problems that may necessitate the placement of a special tube in the lungs for a few days. Other risks and complications are related specifically to this surgery. These are also very rare. However, it is important to know about them. Fluid may leak from around the nerves. There is a very small chance that blood vessels may be injured near the spine, resulting in bleeding or strokes that could be life-threatening. The spinal cord or nerves themselves could be injured, causing possible weakness, paralysis, bowel or bladder dysfunction, and decreased sensation. It is very rare, but sexual dysfunction may occur. The risk of having infections such as AIDS or hepatitis transmitted through a banked bone is extremely unlikely. Though very rare, this risk exists. Some of the risks are related to the use of implantable devices that hold the fusion. These are rare. One of the medical devices may crack before the bones are fused. This will require another operation to fuse the bones. If the metal device under the skin causes discomfort or stiffness, it may have to be removed. This will require another operation. Also, if the medical device slips out of place, it may have to be removed. There is also the possibility that the operation may not help the symptoms or may even make them worse. After the surgery, no repetitive bending or twisting of the neck or heavy lifting is allowed in the few weeks following the operation. A cervical collar or other immobilization device may be used for a few weeks to a few months after the operation. The range of motion of your neck will be limited by this operation. Smoking may slow the rate of fusion of the bone and may even be responsible for the total failure of the fusion. After this period of relative rest, physical therapy may be necessary to allow you to resume your previous activities. How much of your activities you will be able to resume depends on how well you are doing at the time of your follow-up. Your doctor will tell you how long it will take before your neck is healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Spinal fusion surgery can help relieve your pain when other non-surgical treatments fail. This operation is very safe with excellent results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.